What we do here in the gym is a variety of different activities that you might see in gyms throughout the world. We have weights, we have parallel bars, and we're trying to teach people how to walk again after they've had brain injuries such as strokes. We have balls that we use to teach people balancing by sitting on them. Examining tables, people sit down or lie down, the therapist performs stretches, and then we have, of course, routine exercise equipment such as walking treadmills, we have bicycles, we have a variety of different bicycles, and then of course different kinds of walking aids such as walkers and strollers that are critical for people's recovery. All these are tools to create a situation of enriched environments of retraining the brain. You may think about in the past that people have had a stroke and they can never walk again or never talk again. But that's not true. We now know that through exercise, through repetitions, even through melodic intonation therapy, or called MIT therapy, we can get people to have a voice that they once lost. People sometimes after a stroke on the left side of the brain can't speak anymore, but they can sing a song, like they can sing Happy Birthday, or they can sing Twinkle, Twinkle, Little Star. These are right-sided brain functions singing, or speaking would be more of a left-sided brain function. And what we do in rehabilitation, we create a situation where there are mirror neurons in a human's brain that help regain function on the left side of the brain. The situation is singing a song will be the right side of the brain, and then singing the song will teach the left side of the brain to regain voice. We'll be able to sing Twinkle, Twinkle, Little Star or Happy, Happy Birthday, but they will not be able to say the word happy or birthday or twinkle, but in a song they can. That's music intonation therapy. These are just a few of the things we use in rehabilitation other than the physical activities that you might think for rehabilitation after stroke. Hi, thank you very much for letting me talk to you today. My goal is to try to get a little bit of a perspective on patients' families, and specifically I'm trying to get a understanding about how it's affected the family, and more importantly, what component of therapy has been helping your husband. In particular, like to focus on music intonation therapy or music therapy. So do you mind telling me briefly about, how old your husband is and why do you think he had his stroke, what he was doing?
So he's just turned 50, fit and healthy, had gone out surfing at the beach, and while he was surfing, he realised his arm wasn't working. So he hasn't had hypertension that we'd been aware of, and we've been told it's just really bad luck. So
now, when you went through the GP's notes, in retrospect, did they find that there was high blood pressure?
Yeah, the beginnings of it. So that's what I understand.
And the neurologist, I think, suggested that maybe the bleed in his brain was because of the high blood pressure?
Yeah, yep. So because of surfing, that put his body under lots of pressure, and that his, it created a drama in his head.
And where the blood pressure created a bleed, right?
Yeah.
So what kind of functioning has he lost?
He's got no movement on his right side. His face is a little bit droopy, but he's struggling with speech and communication.
Now, when he first came into the hospital, was he making any words?
No, he had nothing. So he would look at us and clearly understood what we were saying to him. He could do a thumbs up and a thumbs down after a few days when he was a bit more settled, and he would nod his head or shake his head, but that's all that he had. No speech, no words, no voice.
So that was pretty frustrating, I assume.
Yeah, for everyone.
And specifically, how his speech is improving, as we both know. What do you think some of the components that helped him get some more confidence about his speech? What happened?
So having the therapist talking with him about what's actually going on has been really helpful, helping him to understand that yes, it is all up there, but you've got a bit of a break between your tongue, what's coming out, and those words up there. He has found it easier if he talks slowly, if someone's looking at his face and he responds to that. So those are for specific words, but he's also, we found when he's singing, words come very freely and just flow out of his mouth. So.
Is that the first time he heard himself speak, is when he actually sang?
Yeah, it was.
And what kind of songs were we singing?
Crazy, silly songs, kids songs, Happy Birthday, Twinkle, Twinkle, Little Star. So really childhood stuff.
Yeah, I remember kind of his expressions when he first heard his voice when singing Twinkle, Twinkle or Happy Birthday. What do you remember about that?
What I remember is him being quite shocked and surprised by it. So he was excited. After we had done that initial singing, he was. I said, "You did well," and he's like grabbing my hand. Yeah. So he was really happy about that. Gave him some hope. Gave us all some hope.
So you think that's called music therapy should be a good component for some patients with strokes that can't speak?
Absolutely, absolutely. And especially right at that initial stage, it gave us real hope that that was a possibility. Whereas before that, it was really hard work for him. He was very frustrated and he couldn't get anything to come out of his mouth. With the singing, it just flew out.
Yeah. And now he's saying, then he started saying simple words like watch and glasses. And now is he using sentences now?
Yeah, he is. Especially if he's relaxed, it's a quiet space, and he's not fatigued, then he definitely can come out with some really clear expressions. He's also moved on from some of the kids' songs, and he's actually making up his own songs.
Oh, great.
Yeah, which is fantastic.
That is great.
So, yeah.
So in terms of this video, my hope is to use these videos for YouTube videos. It's just a beginning of a project. So if I do use this video for YouTube video, is that okay with you?
Yeah, absolutely. Anything that can help. Yeah. I mean, I think the music has made a huge difference for him.
Yeah, and we talked to your husband. He seemed to be happy that you speak as well, but he didn't want to be speak. I think he might have been a little embarrassed with the tube in his nose and all that. Yeah. So he seemed to give okay on that too.
Yeah, absolutely. He was quite happy about it.
Well, I do appreciate it because, part of the YouTube concept is to introduce that patients can have recovery and different therapies that might be used. Thanks very much.
Anytime.
Good. Okay, take care.